Hello everyone, our today topic is about malaria and I will try to present this topic on 5 separated video. The first video will focus on the epidemiology and life cycle of malaria, and the second video will focus on the pathogenesis of malaria, and the third video will focus on the clinical manifestation of malaria, and fourth video on the diagnosis, and fifth video will focus on the treatment of malaria. So when you see the epidemiology of malaria, it is a protozoal disease that is transmitted by a bite of female Anopheles mosquito. So the cause of malaria is Plasmodium species. This Plasmodium species transmitted from an infected individual to the healthy individual through a bite of infected female Anopheles mosquito. So female Anopheles mosquito is the vector of malaria, but Plasmodium species is the cause of malaria. When we see the burdens of malaria, around 95% of burden of malaria is in Africa, 2% burden in Southeast Asia and Eastern Mediterranean, and the remaining is in the American and Western Pacific. And the transmission occurs in around 95 countries in the world and affecting over 3 billion people and can cause 400,000 deaths in each year. So when you see the mode of transmission of malaria Plasmodium species transmitted from an infected individual to healthy individual through a bite of female Anopheles mosquito. But rarely the malaria can transmit from the mother to the fetus by crossing the placenta, that's congenitally, and also Plasmodium can transmit from an infected individual to healthy individual at the time of blood transfusion or sharing of contaminated needles, and also organ transplantation, because most of the Plasmodium species sequestrated in an organ in our system, and also can sequestrated within the red blood cells, so transmitted from an infected individual to healthy individual at the time of blood transfusion or at the time of organ transplantation. But this method of transmission is rare. So the major mode of transmission is bites of female Anopheles mosquito. The other is the cause of malaria. The cause of malaria is a Plasmodium species, and we have 6 Plasmodium species that can lead to malaria. And from that, Plasmodium falciparum, vivax, malaria, and also there are also another 3 Plasmodium species we'll discuss on the next slide. When you see Plasmodium falciparum, it is the most common cause of severe clinical disease, and it covers the largest burden of malaria, and it is the most common cause of malaria, followed by Plasmodium vivax. Plasmodium vivax is the second most common cause of malaria. And when we see malaria can be divided into two. That is the uncomplicated malaria and severe malaria. The most common cause of severe malaria is Plasmodium. The most common cause of severe malaria is Plasmodium falciparum, but rarely Plasmodium vivax and Plasmodium knowlesi can lead to severe malaria. It's also asked questions in the exam. What are the 3 Plasmodiums that can lead to severe malaria? The Plasmodium falciparum, Plasmodium vivax, and Plasmodium knowlesi is the cause for severe malaria, but vivax and ovary is rare. But Plasmodium falciparum is the most common cause of severe malaria. When we see the geographical distribution, Plasmodium falciparum is predominant in sub-Saharan Africa. So the second is the Plasmodium vivax. It is rarely associated with severe malaria, and the severity side in Plasmodium vivax is severe respiratory distress, anemia, and occasionally can lead to death. So Plasmodium vivax rarely can lead to severe malaria, and the severity criteria due to Plasmodium vivax infection is severe respiratory distress, anemia, and occasionally death. And this vivax is common in America. It's common in America and Western Pacific, and it is the second most common cause of malaria, but causes only 3% of malaria attack worldwide. Majority of the malaria is due to Plasmodium falciparum, but Plasmodium vivax account only for 3% of malaria attacks worldwide. But in Ethiopia, Plasmodium falciparum is account around 60% of malaria, but vivax accounts around 44% of malaria. The third one is Plasmodium malaria. It is uncommon Plasmodium species and found in most endemic area where Plasmodium falciparum is common, that is in sub-Saharan Africa. And this Plasmodium malaria may be associated with recurrency The 3 Plasmodium species that associated with recurrence is Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. But the mode of recurrence in Plasmodium vivax and Plasmodium ovale is differ from that of Plasmodium malariae. Because in case of Plasmodium vivax and Plasmodium ovale, there is a dormant stage in the liver, and this dormant stage of Plasmodium vivax and Plasmodium ovale that is found in the liver will be reactivated after some period of time. And the recurrence of Plasmodium vivax and Plasmodium ovale is from the dormant stage that is present in the liver. But in case of malaria, there is no dormant stages in the liver, but the malaria or the Plasmodium malariae parasite that is found in the red blood cells will be reactivated after decades or after 10 years, 20 years, or 15 years after initial infection. So the recurrence in case of Plasmodium malariae is from the red blood cell, but the recurrence in case of Plasmodium vivax and ovale is from the liver. So the source of recurrent infection in case of vivax and ovale is from the liver or hepatocytes, but in case of malaria is from the red blood cells. And the other frequently asked question is which Plasmodium species associated with nephrotic syndrome? It is Plasmodium malariae. The chronic infection of Plasmodium malariae has been associated with nephrotic syndrome. The other is the Plasmodium ovale. It is another cause of malaria, and this ovale has 2 subspecies, Plasmodium ovale curtiusi and Plasmodium ovale walkeri. It is less common and accounts less than 1% of malaria, and it is unusual outside of Africa. The other is nolosi. It's similar to that of Plasmodium malariae under microscope, but we can differentiate nolosi and malaria by using PCR or molecular technique, and Plasmodium nolosi, like that of Plasmodium vivax and Plasmodium falciparum, can cause life-threatening illness, but the most common cause of life-threatening illness is Plasmodium falciparum. And Plasmodium nolosi not yet been proven to be transmitted from human to mosquito. The female Anopheles mosquito needs a bite of monkey reservoirs to be infected by Plasmodium nolosi. So the female Anopheles mosquito needs monkey reservoir to be infected by Plasmodium nolosi and transmitted this Plasmodium nolosi from monkey to humans. When we see the geographical distribution of Plasmodium nolosi, it's found in the Malaysia, Philippines, Thailand, and Myanmar. And Plasmodium simum, it is very simple or similar to Plasmodium vivax under microscopy, and it is found in Brazil. So these 6 species, Plasmodium species, is a cause of malaria: Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae, ovale, nolosi, and simum is the Plasmodium species that can lead to malaria. So when we see some terminologies like endemicity can be divided into hypoendemic, mesoendemic, hyperendemic, and holoendemic. And endemicity traditionally has been defined as in terms of parasitemia. Parasitemia means the level of parasite in the blood and also palpable spleen or splenomegaly. Parasitemia is the presence of parasite in the blood, and it is an evidence for acute infection. And palpable spleen is or splenomegaly is a marker for chronic infection because repeated Plasmodium infection can lead to splenomegaly. So when we see the prevalence of parasitemia and or palpable spleen in the children from 2 to 9 years of age, based on this rate, we can define an area with hypoendemic, mesoendemic, hyperendemic, and holoendemic. In hypoendemic area, the presence of parasitemia or palpable spleen in the children 2 to 9 years of age is less than 10%. In mesoendemic area is around 11 to 50%, hyperendemic 51 to 74, and holoendemic area is greater than 75%. That means greater than 75% of the children in holoendemic area has either of parasitemia or palpable spleen, and it indicates there is high prevalence of malaria in that area or high burden of malaria in that area. And area of hollow or hyperendemic, one person can have greater than one infectious mosquito bites per day, and or a patient could have repeated infections throughout their lives. So in hollow and hyperendemic area, there is a high rate of transmission, but in the hypoendemic area, the rate of transmission is low. The other terminology, very important terminology, is the entomologic inoculation rate. The entomologic inoculation rate is the number of bites by the infectious female Anopheles mosquito per person per year. So the number of bites in a person per year, it is called the entomologic inoculation rate. In hyper and hollow endemic area, the EIR is increasing, and in the hypoendemic area, the entomological inoculation rate is low. So in area where there is a high entomological inoculation rate, it is called high transmission area. But in the area where the EIR is low, it is called low transmission area. So the EIR or entomological inoculation rate is very important to describe the intensity of transmission in the specific area. So area an EIR or entomological inoculation rate of less than 10 per year is low transmission. That means one person can have less than 10 bites by infectious female Anopheles mosquito per year. In this area, this area is called low transmission area. When the bite is between 10 to 49, it is intermediate transmission area. When the bite of one person by infectious female Anopheles mosquito per year is greater than or equal to 15, it is high transmission area. The other is there is the transmission area can be divided into two, or that is the stable transmission area and unstable transmission area. In the area of stable transmission, that means stable transmission means a constant year-round infection. In this area, the entomological inoculation rate is greater than or equal to 15 per year, and the higher the EIR is, the higher the burden of the malaria, and particularly in the young children and pregnant mothers. Because of it, this is a constant and year-round transmission. The infection in adult individual is asymptomatic, because most of the adults are repeatedly infected with malaria, and they can develop immunity, and the malaria infection in adult is asymptomatic. But in young children and pregnant women, there is high burden of malaria. They are symptomatic, because in pregnant mother the immunity is low, and in young children also there is no immunity. So in constant or year-round transmission area, there is symptomatic malaria in young children and pregnant, but asymptomatic in adults. But in area of unstable transmission, the transmission is low and it's focal, and there is no protective immunity in adults. So all individuals, either youngest, pregnant, or old individuals that are infected with malaria become symptomatic. And this unstable transmission is more common in hypoendemic area, but stable transmission is more common in hollow and hyperendemic area. Generally, in unstable transmission area, symptomatic disease may be occurred at all ages, because there is no protective immunity. But in stable transmission area, young children and pregnant are symptomatic, but the adults are asymptomatic. And the other very important concept is what are the three determinants of malaria transmission. The first one is the density of the vector. The higher the density of the vector in the area, there is high transmission probability, and the other is the number of bites per day by infected female Anopheles mosquito. The higher the number of human bites by infectious female Anopheles mosquito, the higher the chance of transmission. And the third one is the probability of the mosquito survival. The more the survival of the mosquito, the higher the number of bites, and the higher the chance of transmission of Plasmodium species from an infected individual to healthy individual. So the density of the vector, the number of bites, and also the survival of the mosquito is very important factor that's affecting the transmission of malaria. From these three determinant factors, the mosquito survival or longevity is particularly important, because the parasite or the Plasmodium life cycle within the mosquito lasts for at least 80 to 30 days. This variation in life cycle of the Plasmodium species is depending on the type of species and also depending on the temperature. Some Plasmodium takes around 8 days and some Plasmodium takes around 30 days. So as you know, the Plasmodium, the female Anopheles mosquito takes a blood from an infected individual, and simultaneously the mosquito takes a Plasmodium gamete, and this gamete should be changed into sporozoites within the mosquito to be transmitted into another individual. So the step from the gametocytes to the sporozoites occur within the mosquito, and it takes from 80 to 30 days. So if a mosquito survival is less than 10 days, the gametes will not change into sporozoites, and there is no successful transmission. So the longer the mosquito survival, the longer chance of transmission. There are around greater than 400 Anopheles mosquito types. From this, 100 Anopheles mosquito type can transmit malaria, but only 14 type of 44 type of Anopheles mosquito can effectively transmit Plasmodium from uninfected individual to healthy individual. But in Africa, the Anopheles gambius complex is the most effective mosquito vector in Africa because the mosquito is long-lived, high density, and breed easily, and bites in around the house, and also it bites humans than animals. So the Anopheles gambius complex is the most effective mosquito vector in Africa. It is very important vectors from all other type of Anopheles. In Ethiopia, Falciparum is the most common Plasmodium. It accounts around 60%, the Vivax around 40%. When we see the vector, Anopheles gambius is generally Anopheles gambius complex is the most important vector in Africa, and from this complex, Anopheles arabinus is also one of the members of Anopheles gambius, and this Anopheles arabinus is the primary vector in Ethiopia, and the member of the Anopheles gambius complex, and the other is Anopheles funitus farons and nidus also found in Ethiopia. The other is the life cycle of malaria. When you see the life cycle of malaria, there is some words in the slide, and you can read, but I try to simplify the life cycles by using a picture from up to date. For example, this is human livers, and it is mosquito, female Anopheles mosquito, and if it is a skin, the female Anopheles mosquito will inject sporozoites. Sporozoites is one of the stage of the Plasmodium, and this sporozoites injected from the mosquito into the human blood circulation and move to the liver. In the liver, this sporozoites multiple around 1,000 times and change it into hepatic schizoid. So from the sporozoites, there is hepatic schizoid, and some of the sporozoites may be stored within the hepatocytes and become dormant. That means it doesn't replicate and become dormant for some period of time and become activated after some period of time. But this is particularly for Vivax and ovary. This dormant stage is called hypnozoid. So hypnozoid is only for Vivax and ovary, and after some period of time it become activated and changed into hepatic schizoid. So after hepatic schizoid, the schizoid will rupture and releases merozoites. The merozoites will infect red blood cells, and within the red blood cells, merozoites change into ring-type trophozoites. The ring-type trophozoites can be differentiated into male and female gametes, or can develop into late trophozoites or mature trophozoites, and mature trophozoites will be changed into blood schizoids. This one is blood schizoid, this one is hepatic schizoid, and the blood schizoid will rupture and release merozoites, and the merozoites also infect another red blood cells. So this cycle will be repeated multiple times, and this cycle from the ring trophozoites to the merozoites, this cycle will take different time or different duration in different species. For example, in the nology, it takes around 24 hours. In Vivax, ovary, and falciparum, 48 hours. In the malaria, it takes around 72 hours. So, one of the clinical manifestations of malaria is fever. The fever is due to the rupture of due to the rupture of the blood stage schizoids, or due to rupture of red blood cells. Because when there is a rupture of red blood cells, the cell membrane, there is when there is a rupture of cell membrane, the different phospholipids become changed into arachidonic acid. Arachidonic acid will change it into prostaglandin, and prostaglandin will increase the set point of the temperature in the hypothalamus, and that can lead to fever. So the fever during malaria is due to rupture of the cell membrane of red blood cells. So during malaria, the fever is in every 72 hours. In vivax, ovale, and falciparum, the fever is in every 48 hours. In morosis, it's every 24 hours, because the cycle takes, or the duration of the cycle is 24 hours, 48 hours, and 72 hours respectively. And the other is sporogony. Sporogony is the life cycle of the plasmodium within the mosquito, as you see or in this picture. The ring trophoblastus, the ring trophozoites, not trophoblastus, the ring trophozoites will change into gametocytes. These gametocytes will be taken by the mosquito, and within the mosquito, the gametocytes will be changed into sporozoites. And the stage or the cycle from the gametocytes to the sporozoites is called sporogony. So sporogony is a life cycle of plasmodium within the mosquito from the gametocytes into the sporozoites. And this sporogony needs a temperature to occur, especially in the vivax. It needs at least a temperature of greater than 16 degrees centigrade. In falciparum, it needs at least a temperature of 21 degrees centigrade. So in cooler temperature, there is no sporogony, so there is no transmission of malaria. So within the mosquito, the gametocytes, especially the microgametes, the male gamete, macrogametes, the female gamete will be mixed and produce zygote. This zygote will change into ookinete, ookinete will change into oocyte, oocyte change rupture and release sporozoites, and sporozoites will injected into human being, and these sporozoites will enter into the blood circulation, to the liver, to the red blood cells. So it's the life cycle of the malaria, and it's all about the life cycle and the epidemiology of malaria, and we'll discuss the pathogenesis of malaria. That is very important topic, and we'll discuss in the next video. And please subscribe the channel, like and comment. Thank you.